Okay, so I'm going to start. So welcome back, everyone. Today we have Professor Deep Mukherjee from Rhode Island College from the Department of Health and Physical Education, correct?
Yeah.
Which I think when we hear that, we think, oh, that's all for people who are going to teach PE. But it's not actually the case, right?
That's part of it. I mean,
yeah.
that's part of
right, but
it. But
from another program, I think, right?
Yeah, that's correct.
So, so it would be great if you would start, Deep, by sharing your own personal story and then professional story. And I know, as we admit a few more people, if the students want to type into the chat what your interests are, that was the question before.
Right. So can I start sharing my screen?
Yeah, go ahead and share your screen, and then we can get started. So. We'll have, if you can pause once in a while for interpretation, that would be great. And then if students have questions as Professor Mukherjee is talking, you can type those into the chat as usual, and we can.
Can you see my screen?
Yeah.
Okay. And if I go too fast or anything, I will try to remind myself to pause, but if I don't, please feel free to interrupt. Okay. If the students are shy, Erin, please, please feel free to, but I'll try to go.
Students can type questions into the chat as things come up, and then we can return to them later.
Yeah. So hello and welcome everyone. How is everyone doing today? Yeah, you can type into the chat box. I will try to check from time to time. I have tentatively titled my presentation as Public Health, What, Why, and How, because it's kind of like that. At least when I started doing public health, I myself had a lot of questions. So I think I am starting from that perspective, though I know that now, probably now with the COVID-19 and everything, we are more familiar with public health than we used to be back in our days, but I'll just assume that. As Professor Erin mentioned that I go by Dr. Deep. I have a long name. I am affiliated with the Community and Public Health Promotion Program in the Health and Physical Education Department in Rhode Island College. And as your professor was saying, this department houses multiple programs. So there is health education, physical education, there is also teacher prep, and then there are these community-based programs, which is, one is community and public health promotion, the other is wellness and exercise science. So, any question right now? No? So let's start a little bit about myself as we were talking about. So I come from about 8,000 miles to the east of here. I always find that kind of, even though I know how far it is, it's still in my head kinds of, when I remind myself the distance, it sounds overwhelming. So just for our interest, I will quickly note a few things. And because we are talking about being bilingual or multilingual, so my native language is Bengali, or Bangla as it is known as. And what you see here within parentheses is actually Bangla written in Bengali font. That's how it looks. And yeah, like most of you, I have the usual hobbies. Most of these are, I think, pretty common. Sleeping, eating, traveling. The one that you see at the end, again, talking about cultural relevance. This is something for which I find it hard to find an exact English translation. It is pronounced as adda. It's a Bengali word. it's kind of having informal conversations, but it's not simply like, it's supposed to be not as simple as chit chatting, although there is nothing wrong with that. But say sitting in a cafe in Kolkata in India, where I am from, it's the main city of West Bengal. We are discussing about policy issues in the US, or as sometimes people in my parents' generation used to joke that sitting in Kolkata, where there are a lot of problems, obviously it's a developing nation, we are discussing about the Vietnam War, the Korean War, and things like that. So Adda can start talking about a lot of serious issues, political issues, social issues. And I think that somewhere comes into my upbringing and comes into my background, which later on channelized into my interest in public health. In terms of my higher education, after my high school, I went to medical school in India. Now the medical school system in India is a little bit different. In some ways you can think of it as less complicated than it is here. So we first go to medical school, and you can do it right after high school. You do not need to have an undergraduate degree, but it's a general physician kind of degree. So almost like a family physician, and it's known as MBBS. There are, I think there are many countries, especially those that were British colonies for a long time, where although they have changed, it's still MBBS in many parts of the world. So after my medical degree, I worked in hospital for a while, and then I went into a school of public health, and I did a 2-year diploma in public health. And how that transition came about, I will talk about that a little bit more. And then after doing my diploma, I was looking for opportunities for higher studies, and that's how I came to the US to do my PhD in public health in Florida. And we can talk more about these if you have questions. So any questions at this point? And these are some of the pictures. So of late, I am trying to be more vigilant about the photos, whether they are open source and things like that. Now, these 3 photos, I didn't have to worry about those because those were all taken by me when I last visited India in 2017. Those are all in the city of Kolkata. As you can probably not see so much, but kind of form an idea that it's a very crowded, India is a very crowded country in general. But the urban places are extremely crowded. Like the population density is, I would compare it to New York City, for instance. That's how crowded it is. So think about social distancing in that context, right? Any questions?
If you'd allow me to, can I translate that last slide? Okay,
Yeah,
so
sure.
thank you. So él nació y creció en India. Su lengua materna es el bengali. Le gusta ver películas, música, leer, dormir, comer, viajar. Le gusta conversar sobre temas sociales, políticas y sociales, y temas sociales. Fue a la escuela de medicina en India. Tiene su diploma de salud pública, doctorado en salud pública. Y en las fotos se puede ver, él las tomó en India en el 2017. Y él dice que es muy importante ver que hay muchas personas viviendo en India. Es muy poblado y que tal vez no se puede hacer la distancia social allá. Es difícil. Disculpe. Thank you.
Thank you, Karen. Any questions? I'm sorry, if you hear a sound in the background, that's my 9-month-old son. He gives out this excited shrieks from time to time. So, okay, so the next question would be, so what I am doing now, right? So I talked a little bit about that, about my education. So these, speaking very generally, and I'll get more specific, very generally, I do teaching, research, writing, and service. So because it is public health, there is always service involved. In general, any faculty that you talk to does all of these things. So nothing unusual there. So what are some of the things that I am teaching? One is definitely, because from the name of the major, you can guess it's community and public health. Epidemiology, you may or may not have heard about this. We are increasingly hear about it again with the COVID-19 and all the discussions in the media about recommendations and whatnot. Health promotion, health education. These are some of the main subjects that I teach. But I think it's the topics of interest that will probably be more relatable, and that's what probably makes more sense, because public health is so non-specific in many ways and covers so many things that it is sometimes easier to give examples than actually describe what public health is. So some of my interests, and public health goes way beyond that. Some of my interests are vaccinations. So specifically, why are some of us more acceptable to vaccinations, more ready to take vaccines, whereas others are not so much? Mental health has always been a big focus of mine, mental health and prevention of suicide, especially among young adults, middle school, high school, and also young adults. Climate change and health, how climate change is impacting health. So we are in Rhode Island, which is an ocean state. And the place where I come from, the state of West Bengal in India, and the part of West Bengal I come from, it's coastal and low-lying areas. One of the most vulnerable places in the world to climate change, rising sea levels. And unfortunately, the health implications of climate change are not studied that much. It's a new topic, and I am still learning that myself. I am trying to educate myself about that. Racism and health, any kind of discrimination, and more specifically racism and its implications on health is an interest. Prevention of bullying and school safety, health implications of traumatic experiences, childhood trauma or trauma throughout the life, health disparities, you can think of it as health inequalities that are unfair. So a lot of health inequalities are related to issues of social justice. So more specifically, minority and immigrant health, stigma and health. So these are only just some of my topics or some of my areas of interest. And the figures are again taken from an open source. I'm forgetting the source, but these are for representational purposes. But many of these guidelines, for instance, the 6 feet apart, social distancing, the wear your mask, these kind of things, the recommendations are made by the people who make these recommendations, you can say, are one part of public health. The epidemiologists are also involved in these recommendations. Any question here?
If I could just translate.
Yeah.
So,
Sure.
Lo que él hace para ganar dinero y sus intereses, él enseña salud pública comunitaria, promoción de la salud y educación, vacunas, salud mental y prevención del suicidio, cambio climático y salud, racismo y salud, prevención de la intimidación, impactos en la salud de trauma y salud de minorías y inmigrantes, y también el estigma contra la salud. Thank you.
Thank you. Any questions, anyone? If anyone has written any question in the chat, please feel free to let me know. I'm checking. I don't think anyone has any question up till now, but if anyone does, please feel free to remind me, okay? So the next thing that obviously comes up is, what do we mean by public health? So I started talking about it a little bit, and I'll see if I can play this video. Sometimes, can you hear the sound?
Yes.
Okay, so I'll increase the volume of my computer.
As we create the healthiest nation in one year.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduced prevention and early detection activities that helped increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution, and the Flint, Michigan lead crisis taught us the dangers of our aging water systems. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA as we create the healthiest nation in one generation.
So thanks for watching. Karen, I know it's a long video and there is no transcript, at least right here, but would you want to translate the main ideas of the video?
Sure.
Or summarize? Yeah.
Yep. So la salud del público es mucho enfocado en la justicia social. Estaban hablando sobre donde tú vives, dice mucho cuántos años vas a vivir y qué problemas de salud tal vez puedes tener. Y el trabajo de él es muy enfocado en arreglar esos problemas entre las comunidades. And I might be missing something maybe, but that's pretty much the gist of it.
Okay, thank you. No, there was a lot in that short video, but thank you. And I am not going to read this. This is a more traditional definition of public health, which you can definitely read. But I will talk a little bit about my interest, and that will probably be relatable. So, like I said, after going to medical school, when I was working in hospitals, and when you are a junior doctor or a trainee doctor in hospitals, in India, the system is that you can pretty much do work under any doctor in that specialty. Of course, you will do the basic kinds of, you are basically assisting them. You are not doing, so it sounds like when I tell people that I worked in the cardiomedicine ward department for about 6 months, it can seem surprising, but it is not, because I was still doing the basic kinds of work and learning a little bit of cardiology specific things there. So it was all very exciting, and there was a lot of learning going on. It was hard work. But one of the things that like it struck me after a while is that we were having people, 28-year-old people. I remember having a 28-year-old male who had suffered a heart attack. He survived the attack, but that was one of the completely eye-opening things for me. And then it all started to kind of dawn on me that this whole system of hospitals and high-rising hospitals, the cities have pretty good hospitals in India, whereas millions and millions of people lack basic health care. So all of these didn't seem to make sense. The math just doesn't add up. Where will people get access to the care that they need? And what if we could prevent all of these? There is a popular analogy is that we need traditional medicine, we need traditional nursing, and there is a lot of overlap between public health and medicine and nursing. In fact, they can be part of each other. However, traditionally, the way we see medicine, it's almost like someone has thrown a stone and broken your window. And then we are trying to find the right mechanic and the right materials to fix that window. But what if we could build the window in such a way that it would not be so easy to break it? Or we could strengthen the house in such a way that even if the window breaks, the whole house does not break down during the rain or the snow or the summer. So it's kind of an analogy to what the difference between public health and traditional medicine. So prevention is a big part of public health. We want to prevent the disease before it happens. We want to prevent the complications, and anywhere that we can prevent things from getting worse. And another aspect of public health that they were talking about in this video is, over a long time, there have been too much focus on me as an individual doing things right. So for instance, making the right choices, eating the right food and things like that. But public health, especially more now than ever, recognizes the role of societal factors. So things that go beyond my control. That does not mean I no longer have any responsibility for my health, but there is only so much that I can do. If I am living in a food desert, for instance, where there are no access to healthy groceries, there is little that I can do. If I am living in a neighborhood that is unsafe, no matter how much you advise me to take a walk, I may not do that. So those kind of things that are relevant to in any country, but especially there is also a lot of disparities within the country between rich and poor neighborhoods based on zip codes and so on. All of those things fall under the purview of public health. under the different disciplines of public health. Any questions at this point?
So, él también estaba hablando que se sorprendió cuando trabajaba en un hospital en India, que un joven de 28 años tuvo un ataque del corazón. Y él preguntó cómo podría ayudar el seguro de salud y que quiere prevenir enfermedades y complicaciones. Y él está trabajando en un enfoque de la salud pública.
Thank you. Does anyone have any questions at this point?
Good morning, Dr. Deep. My name is Zach Pinto. I'm a teacher at Mount Pleasant High School.
Hi, Zach. How are you?
Great, thanks. I just kind of wanted to connect back to a previous slide. Just something that popped up in my head. You brought up the fact that you work closely with mental health issues and you're an advocate in that realm.
Yep.
The question I have is kind of twofold, and it's targeted towards the students that are going to be going into high school this year. One, the first part of the question is, if you are someone that is battling with mental illness, what is the first step you should take, or what do you suggest as to how to try to manage that? And the second part of that question is on the flip side. If you are someone that knows someone dealing with mental illness, what is a suggestion for that person to help those struggling with mental illness?
Thanks for the questions, Zach. Those are great questions. So first of all, if I feel like I am, as a student, I feel like I am having issues with mental health, and I have had such experiences myself. So especially when I first arrived in the US from India, the only difference was I was quote unquote an adult then. I mean, I was grown up then. I was more than I was at least, I think, in my late 20s. But still, it was quite a learning experience being all by myself and having to go through those struggles. Now, if I recognize that I am having the struggles, I think most important is to recognize the resources that are closest to me, right? So for instance, when I was in the university, it took me a while to know that the university has these services, like the mental health services, the counseling services, where I could access things free of cost. Now, different settings may vary in their, and the specifics can vary, but I think most schools and most colleges and universities have those kind of resources to help. But when the other thing to also remember is to be kind on ourselves. So when we are having these mental health struggles, it is very easy to keep blaming ourselves. That's the easiest thing to do. I think the hardest, we can all be kind to others, but sometimes when it comes to ourselves, it's difficult to be kind. So I remember, even though I knew that I have these counseling services, those are free, not exactly free. I mean, we all are paying part of our fees for that. Even knowing that when we are really struggling, it takes an additional effort to even bring yourself to seek that help. But only we ourselves can do that. And that's where I think the next part of his question is important, is if we recognize someone that we care about, be it a friend or someone we know who is going through these struggles, it is very important to listen to them. But also, we are not trained as psychological counselors. So we can listen to them, but we have to find a way to be non-judgmental, and yet we can communicate that, would you want to see or check out this resource? Sometimes it is said that it is good to take a friend if they are willing, of course. It is very important that they feel empowered, because that's the worst that we can do at this point, is force what we think is right on them. So would you mind, if you want, I can walk with you to the counselor. I will, of course, I will not be with you when you are talking. That should be private, but I can, I can make that connection, because that requires some effort. So recognize all the resources in the school, in the community that is out there, having the conversations, and most importantly, to not blame yourself and to come out of that stigma, which again has a lot of cultural dimensions. From India, where I come from, for instance, mental health is still it's becoming more open conversation, but it's still, for many people, it's a taboo. You don't talk about that. You take care of about that on your own. I think that's a problem. I don't know, Zach, if I answered your question. It was a long rambling response.
No, that was great. Thank you very much. I appreciate it.
Any other questions?
Yes, I have a question. Hello.
Hi.
Yeah, my name is
Hello.
Selena. Yeah, I'm
Hi,
one of
Selena.
Thank you. Hi. I'm one of the mentors for this summer's RIC MPHS summer learning program, and I just want to say so much, Dr. Mukherjee. Is that how you pronounce it?
Yeah.
Okay.
You can just call me Dr. Deep or Deep. Anything is fine.
That's one. Right. But I just want to say thank you so much for presenting and being our guest speaker for today. And I have a question, because I do realize from the other slide, it mentioned racism in public health. And I did want to ask, for those who are interested or those who are already in the public health profession, I wanted to know, what are ways for those professionals to actually advocate for preventing, racism in the public health, profession? Because there has, in healthcare, is, racism in a lot that happens, and that's why, there's certain people, especially like minorities and, those who are undocumented, can't get healthcare because, they face a lot of racism and burden in the public health. And, I do want to, that's my basic question is, how can public health professionals prevent or find ways to prevent, racism in the public health profession?
Yeah, that's an excellent question. Thanks for asking, Sarana. So the reason I moved to this slide is because if you look at the lower right, this particular article, this was published in our Rhode Island College news, and it talks about how the coronavirus pandemic has had a differential impact on different racial and ethnic backgrounds, with Hispanics and African Americans being affected more, or even among those that were affected, they are often having the more complications and more severe consequences. So that is not entirely about racism, but a lot of that is. Now, to answer your question, how we can advocate as public health professionals on the prevention of racism, I think for a long time, what we did as public health, definitely in more traditional medicine, but also in public health, is we would bypass the term racism. And I'm being, this is like complete disclosure. This is exactly what used to happen. So we used to use words like racial disparities, which is not a wrong word. We used to use words like racial discrimination. That is still going to a certain extent. You are addressing the discrimination. But of late, I would say not more than 5-10 years, we have at least started addressing racism more explicitly. So the first thing is we have to acknowledge that there is a problem before even doing anything about it. And I think we have been somewhat late in doing that. We have talked about racism probably in a lot of different other disciplines. But in health sciences, we have been a little late in catching up. There were some researchers though who have been studying these for a long time. So it's not just, there are data, and I was talking about epidemiology, which has a lot to do with data and numbers, but there are these quantifiable methods to show that it is not the education, it's not the income, it's not anything else. Even when you account for all of those differences, there is still a substantial difference between the health outcomes of blacks and whites, of Hispanics and whites, and so on, American Indians and whites. And that is really, those kind of information is really compelling. Those will not drive policy changes in a single day, but at least, as you will hear, we hear sometimes in the news that more and more city legislatures, for example, are now acknowledging public health, racism as a public health crisis, as a public health emergency. This, I think, is a novel development. And this is also fueled by the Black Lives Matter movement, largely, and with all the growing awareness. But I think the scientific evidence on the implications of racism is also accumulating, and now we are more vocal in communicating about it, which I think that also goes back to our role as health educators and health promoters. Health advocacy is a big part of that too. So as public health professionals, we can go to the State House, for example, to give testimony as to if a particular bill that is coming up sounds discriminatory, then we can give testimony against that. We can give testimony for that if there is a bill that will protect public health. So those are some of the roles of public health professionals. Does that answer your question, Selena?
It did. Thank you so much.
You're welcome. Any other questions? So a lot of the roles of public health and community and public health professionals, I think one of the fascinating things of public health is it is so multidisciplinary that you can take pretty much any interest. You can take any example that say, I am interested in math. Do I have something to contribute to public health? Oh yes, you do. You have a lot to contribute to public health. Okay, but say I have no interest in math. I am interested in the humanities. I'm interested in political science, social science, history. Do I have something to do with, to contribute to public health? Yes, you have a lot to contribute to public health. So starting from the quantitative sciences to the qualitative sciences, starting from humanities to hard sciences, biology, microbiology, those are the more intuitive ones. So I'm not even going for that. But anthropology, sociology, economics, you name it, criminology, psychology. So you think of any discipline and it has its piece in the puzzle of public health, which is something amazing. And public health, I wish I had more, this is what happens when sometimes I'm working from home. I think I will get things done before the meeting, but then I miss things. I wish I had more of the activities that our interns do, because there is an internship involved in the program. But this is one unique example. I don't think any of our interns had to do this before, but this year, because of this unique situation, one of our interns, she was working with, I'm forgetting the organization. She was interning there, and one of their the target population in underserved areas, they were having difficulties finding people to deliver meals. And so that this particular intern filled in that role for some period of time, and it was a huge learning experience for her. So those kind of things, probably you are going to do something new that no other intern has or no other professional has done before, or you might do something that a lot of people are already doing. There is a lot of variety. I will not read through this slide, but this has some of the career options for public health graduates. Now I'm talking about public health in general. When it comes to health promotion, community health versus public health, there are some subtle and nuanced differences. If you have questions, we can talk about that. But by and large, you can think of this as a public health discipline. And these are some of the employment opportunities or higher education opportunities from after doing your undergraduate in public health. Questions? Any, Karen, if you want to translate anything in the last couple of slides.
So I think I'll translate the slide. So aquí hay él creó una lista para empleo después de que un estudiante recibe su título en la salud del público. Entonces aquí tiene en el azul son posiciones de trabajo después de tener el bachelor's, y después aquí en el rosadito es para los que se gradúan con sus masters o más, o doctor o más. And I just wanted to mention we do have 2 questions from students in the chat.
Oh, okay. Yeah, I'm sorry, I didn't take a look at it.
Oh, no worries. So we have Nicole. She says, what age group do you think suffers more from depression or anxiety, and why?
Oh, that's a great question. Which age group suffers more? So I will start with which age group suffers less. Of late, it is being, so for a long time, we used to think that as people grow older, they tend to have more time to think and ponder, and that's when probably they suffer more of these problems. But we are increasingly seeing that after the age of 50, a lot of these problems of depression or stress, they plateau or they even subside a little bit. On the other hand, it's often the young adults, starting from high school students to college students. Some surveys have shown that as many as 30%, in some cases even more than that, 1 out of every 3 high school students, for example, 1 out of every 3 college students suffered from significant depression at some point within the past year. And again, I don't remember the statistics on top of my head, but young adults are at a very vulnerable age group, both in high school, sometimes even middle school, and as well as in colleges and universities. Was there another question?
Oh, sure. Can I just translate that? It was a great response.
Oh, yeah.
So, Nicole dijo, ¿qué grupo de edad crees que sufre más de depresión y ansiedad y por qué? Y él dice, estudiantes de secundaria y estudiantes universitarios sufren de depresión a más del 30%. Y dice que 1 de cada 3 estudiantes universitarios sufre de depresión y que los adultos jóvenes están en el más riesgo de depresión. Okay, and then we have Kayla, who asked, do you often feel the same way your clients feel? Or maybe empathize, I think.
Okay, I see. That's a very interesting question. So, I mean, yeah, in many ways, we do, right? Or if you ask me personally, I do. So here, when a lot of my work does not involve me interacting with clients on a one-on-one basis, because I am mostly dealing with students and I am talking with professionals, but indirectly sometimes I do, because the students are probably interning somewhere where they are interacting with clients. And a lot of times when they are working, I think here I have list of some of the places where they have interned or employed. There is a wide variety of places. So for instance, when if they're interning in Sojourner House, this one, which some of us may be familiar with, it's a, I'm sorry, didn't want to open the link. It's a advocacy organization, women's against domestic violence, and our interns have worked there, interned there. So when we are working in a place like this, we cannot help but relate to your clients and empathize with your clients. So the reason I say this is a very important question is because many a times in these kind of organizations, the workers have to make sure that they take care of themselves. Because even if they are professionals, even if you are a trained counselor, you can still get affected by what you are hearing. Again, it is difficult to be kind to yourself. So sometimes these professionals have to make it a point to designate some days for their self-care, because it's a lot to take when you hear about some of the experiences. I mean, just sometimes listening to the news media, some of those incidents are traumatizing. I don't know if any, I am sure many of you have heard of the incident, I think yesterday, where this mom was traveling with 4 daughters and they were stopped at a traffic check or something. And then that 6-year-old, the youngest was 6-year-old, and even she was, all 4 of them, including the mom, were handcuffed, face down. I mean, beyond the point, it got like, what are they even talking about? How is that even possible? So it's, when they're interacting with clients, they're obviously getting affected, but it also is a great opportunity. What I hear from a lot of students is it eventually helps all of us to grow. And sometimes it also helps us to realize that we are more privileged than others. We might be less privileged than a lot of other people, but like they really say that we feel lucky that we never went through that experience, which is one way to be thankful about, and also advocate about those who are less privileged than us. Right. Did that relate to your question, or did I go tangent? Sometimes I tend to do that.
Thank you. I'm going to just translate for our Spanish speakers.
Yeah.
So Kayla preguntó, ¿te sientes a menudo de la misma manera que tus clientes? Yo dije sí, en muchas maneras sí me siento. Gran parte de mi trabajo no implica que trabaje de manera individual, pero a veces interactúo con clientes y estudiantes cuando estoy haciendo prácticas o cuando ellos están trabajando en estas organizaciones. Por ejemplo, los trabajadores contra la violencia doméstica. Así que cuando trabajas en un lugar como este, no puedes evitar relacionarte o empatizar con tus clientes. Y creo que esta es una pregunta importante porque incluso si usted es un profesional, puede verse afectuado por lo que está escuchando. Y designe algunos días para el cuidado personal cuando trabaje en este sector. Y algunos estudiantes realmente se sienten afortunados de nunca haber pasado por las experiencias que tal vez sus clientes tienen. Thank you.
Thank you.
Kayla has another question also.
Yeah, I was just looking at the chat. Actually, what I am thinking of is I have a couple of more slides, but I think the questions are more interesting. So I will send the slides to Professor Erin, and she can share. But Can I stop sharing for a second? And I don't think we have a lot of time, but I would rather we have face-to-face conversations, right?
Yeah, that sounds good. We have about 5 minutes or so.
Yeah,
and we're a little bit flexible about the end time, so but about 5 minutes. So yeah, that would be fine.
Okay. Hi, Kayla, I see your questions. So I will address your last question first. How many kids do you help in a year or patients? Now, again, that's probably, it's difficult. So unlike hospitals or nursing homes, it is not like we have a set number of patients per day or a set number of visitors or clients. It varies a lot. So for instance, one of the slides I was sharing is about an intern. Her name was, she graduated this year. Her name was Brianna. She worked in Community Care Alliance. Community Care Alliance is this huge organization which is mainly housed. She was mainly, the office she was going to was in Pawtucket, I believe. I also visited that office a couple of times. But they have locations in many different places. So, so definitely some place like that is addressing many more clients, and they address all kinds of clients. So sometimes what these community organizations are trying to do is they are trying to fill all the gaps essentially in the continuum of care, because there are a lot of gaps. So if let's say below poverty person comes in, they may need multiple help, and an organization like Community Care Alliance tries to do that, tries to connect them to where they can get access to unemployment benefits, for instance, food stamps, more health related, more directly health related things, of course, but things that go beyond that, connecting them to the resources. So in that respect, I'm sure it goes to, I mean, thousands, hundreds definitely, but probably thousands, how they are helping. These organizations are helping. But also many of our interns and students and public health professionals in general, they are working in, say, the Rhode Island Department of Health. That again is a vast organization. So I had one intern, for instance, who was in the Department of Family Visiting. So they used to go visit houses where there was someone was pregnant, and usually those were in underserved communities, and there was a history of, I think, substance use there. So that particular branch of the Department of Health was specifically dedicated to providing education, providing resources, providing any medications that are needed to those families, and reaching out to them. Again, resources are limited everywhere, so they can only do so much, especially the health departments, and that's where the community organizations play such a crucial role. And Kayla had another question, I think, right? Carmen says setting boundaries are vital. Yeah. That's very true. Kayla says, what made you realize you wanted to study this? Kayla, by this, do you mean like public health or mental health? Okay. I think when did I realize? I think when I realized about my interest in public health after delving a little bit into public health. So, like I said, when I got interested in the preventive aspects, how you can make changes in the lives of vast numbers of people so as to prevent diseases. That's when I thought I will see whether I am really interested in public health. A lot of, in some ways you can think of it like testing out a major when we are in undergraduate. So, and that's when I realized that I really was liking these concepts of different levels of prevention, epidemiology. I often describe epidemiology as being detectives. Like if you are interested in thrillers or detective stories, epidemiologists have a lot of common with that, and I can go on and on about that. But that that was one aspect, and specifically I always had an interest in mental health, probably since I was in high school, partly because I often felt a certain way, and it seemed that I should not feel that way. And it's in India, it is not common to have these mental health resources in ordinary schools, the schools that I went to, for instance. So I didn't even know that that existed. That was a thing. So I was like, yeah, I shouldn't feel this way. I should feel energetic. I should feel motivated. But what's wrong with me? And that experience led me to focus more on mental health. Other questions? Great questions. I mean, I didn't even realize that an hour passed so quickly.
Yeah, it is already 12:30. So I think we could take one more question, and then we will transition to our closing community meeting and end our day. But so we have a little flexibility. ¿Alguien tiene alguna pregunta más para Profe Deep?
I do, if I could ask.
Yeah, go ahead, Lily.
Hi, I'm Lily. I'm one of the mentors. I was wondering, if you hadn't gone to medical school, what would you have been? Like, what was your plan B?
So, so just I'd rephrase that a little bit. I mean, I had gone to medical school. I think what you mean is, if I had been in a more traditional, I had still been in a more traditional, like, doctor's role. Is that what you mean?
Did you always want to go to medical school? Like, did you want to do anything before that?
Oh, you mean instead of medical school? If
Yes.
I hadn't gone, I misheard the question. I'm sorry.
No, it's okay.
So I was, what had I? The reason I guess I'm struggling to answer this question goes again back to culture, right? So this might sound funny, but in a lot of South Asian cultures, and I will specifically talk about Indian cultures, from an early age, you are kind of made to realize that if you have to do anything in life, you have to, first of all, go to science, in the direction of science. And then you have to choose a professional path like engineering or medical. Those two are huge. So I think I often joke that it is not me who completed medical school, it's my mom, because my mom had this huge, she, I think, wanted to go to medical school, but at that time, because of traditional family issues and all of that, she did higher education, but she didn't go to medical school. And that was, so every time anyone asked me, I would say, yeah, I am interested in medical. What that meant was I was interested in medical more than engineering. But when I went to medical school, I realized that other than those preventive sciences and bits of like the mental health, psychology, psychiatry, and some aspects of medicine, it's not that I had this overwhelming interest in medical school. I somehow scraped through medical school. And again, this is me being complete disclosure. But it was we had a subject called preventive and social medicine, which was the first trigger of my interest towards public health. That most of my friends hated that subject because you had to read everything from sanitary latrines, how a flush system works, how a commode system works, how a large scale water filtration system works. And most doctors or intending to be doctors would be furious to read that. Somehow they had to. And that was the subject that I felt most comfortable with. So that is probably also goes back to Kayla's question on when you realized that you wanted to do this. In terms of public health, I think that was one of the early clues. But had I not been a doctor, I don't know. I liked physics, I guess, a little bit of the sciences. I also like literature, Bengali especially, also some aspects of English. So we had to, it was compulsory to study English and Bengali until grade 12. And different boards have different systems. The board I was in, that was the system. And in grade 11, 12, I realized that I am supposed to have this intense liking for science. I am supposed to have this intense craving for medical or engineering. But the only subjects I seem to be really enjoying are English and Bengali. What an irony, but yeah, anyway.
I noticed a lot of people kind of nodding, connecting with that. I think culturally that's similar in Latino culture, Hispanic culture. Maybe Frida, you also in your culture, is in Ghanaian culture, maybe similar, kind of that pressure to go into sciences, engineering, law, things like that, right? But I think
there are reasons for that. I mean, we cannot blame our generations because they were at a time of when they had witnessed firsthand that being in a general science or general humanities kind of with a degree like that, there are not a lot of job options, etc., etc. So, but again, everything has its pros and cons. So that's the flip side of it. Other questions? Or I hope it was a little bit helpful. And I'll send you all the presentation that I created. If they have more questions, they can reach out, or you can communicate. You can forward their question to me.
Okay. Thank you so much for taking the time to share your story and so much about public health. I think we probably all learned a lot today.
Thank you. Yeah. Thank you for your interest. And I wish I could get introduced to each of you, but I know that would take more time. So I look forward to meeting some of you, at least in the future.
Yeah, hopefully someday when COVID passes and we can have in-person gatherings again. Yeah.
Okay. Thank you. Okay. Bye. Have a good one.
Thank you so much.
Stay safe.
Okay. Bye. You too. Bye-bye.
Bye. Bye.
You too.